Well, we've heard about the risk factors that can cause COVID-19, but what do they actually look like? Somebody from HudsonAlpha actually gave a visual presentation today to show us how it works. Here's Kenesha Dees with the story.
Science expert Dr. Neil Lamb with the HudsonAlpha Institute for Biotechnology says that people should consider risk factors based on time, space, people, and place.
What is my own personal risk that I'm willing to take on? And how does that overlay on top of what my risks are just by who I am and what I automatically do in the world?
Lamb starts with using jars as an example of your exposure for a 10 to 14-day window. The jar size depends on your personal risk. This includes age, gender, underlying health conditions, and ethnicity.
And you might even have somebody that has a really small jar because maybe they have an autoimmune disorder and their immune system can't respond, and they need to really be careful about the risks that they expose themselves to.
You should also think about household members and the positive COVID-19 cases in your community. Those balls are the activity and range of risk, such as going to a barber or salon.
This is a larger risk because it involves more face-to-face prolonged content. Somebody who is looking at me in the face as they're cutting the front of my head.
Lamb says it's also important to consider interaction with friends.
Is your friend somebody who's always isolated, who doesn't go out in large spaces? Or is your friend somebody that is going to lots of different events and gatherings of all different sizes multiple times a week? As you think about what your jar looks like, don't think about this on a today, how can I fill my jar as full as possible? You want to think about, what am I doing in the next week, the next 10 days?
And Lamb encourages people to continue to manage their risks by practicing social distancing and wearing masks. Putting the Valley first, Kenesha Dees, WZDX News.